I know exactly why you're watching this video right now. There's something you've been ignoring, something that's been waking you up at night. Maybe it's that weak stream when you urinate. Maybe it's the fact that you can't make it through a movie anymore without rushing to the bathroom. Or maybe it's that uncomfortable pressure you feel down there, the one you keep telling yourself is just part of getting older. Let me be clear with you, it's not just age, it's your prostate, and it's asking for help. Now, before we go any further, I need you to do something. If you're a man over 40 or if you love someone who is, hit that subscribe button right now. What you're about to learn in the next few minutes could change your sleep, your confidence, your relationship, and honestly, your future. Stay with me. My name is Dr. William Carter. I'm a board-certified urologist and pelvic surgeon, and for the past 15 years, I've seen thousands of men walk through my office door. Most of them waited too long. They ignored the signs. They were embarrassed. They thought it would just go away. It doesn't go away. Here's what most men don't know. By age 50, about half of all American men will experience symptoms of an enlarged prostate. By 60, that number jumps to 60%. By 80, it's over 90%. And here's the harder truth. Most of those men will ignore those symptoms for months, even years, before they finally get help. They tell themselves it's normal. They tell themselves everyone deals with it. But you don't have to live like that. Let's talk about what your body is trying to tell you. Because your prostate doesn't speak in words, it speaks in symptoms. And if you know how to listen, you can catch problems early, before they become serious, before they steal your sleep, your dignity, and your peace of mind. Warning sign 1, frequent urination. You used to go once or twice during the day, no problem. Now, you're mapping out every bathroom on your route to work. You're excusing yourself from meetings. You're planning your life around where the nearest restroom is. Sound familiar? Here's what's happening. Your prostate sits right below your bladder, wrapped around the tube that carries urine out of your body, the urethra. When your prostate enlarges, it squeezes that tube. Your bladder has to work harder to empty, and because it's working harder, it becomes more sensitive. It starts sending you urgent signals even when it's not that full. You think it's just inconvenient, but your body is telling you something is changing. Most men brush this off. They say, I just drink a lot of water. But if you're urinating more than 8 times in 24 hours, that's not hydration. That's a warning sign. Warning sign then 2, nocturia, getting up at night. Let's be honest, you're exhausted, used to sleep through the night now. You're waking up once, twice, maybe 3 times just to urinate. You stumble to the bathroom in the dark. You stand there waiting for your stream to start. And by the time you get back to bed, you're wide awake. Your partner is frustrated. You're frustrated, and you're starting to dread going to sleep because you know you'll be up again in a few hours. This is called nocturia, and it's one of the most common and most disruptive symptoms of prostate enlargement. Here's why it happens. During the day, gravity helps drain your blood. At night, when you lie down, fluid that's been sitting in your legs and lower body gets reabsorbed into your bloodstream and filtered through your kidneys. More urine is produced. And if your prostate is squeezing your urethra, your bladder can't hold as much. So it wakes you up. You tell yourself it's normal to get up once a night after 50. But if you're getting up 2 or more times, that's not normal aging. That's your prostate. And here's what most men don't realize. Chronic sleep disruption doesn't just make you tired. It affects your mood, your memory, your immune system, your heart health, even your testosterone levels. You can't ignore this and expect to feel like yourself. Warning sign then 3, weak or slow urinary stream. Remember when you were younger, you had power, you had control. Now, it's like a trickle. You stand there waiting. It starts slow, it stays slow, and you wonder if something is seriously wrong. It is. When your prostate enlarges, it narrows the urethra. Think of it like a garden hose. If you pinch the middle, the water flow weakens. That's what's happening inside your body. Some men compensate by pushing harder, straining to empty their bladder. But that makes things worse over time. It weakens your bladder muscle. It increases the risk of urinary retention, where you can't empty your bladder completely. And that leads to infections, bladder stones, and even kidney damage. You might think a weak stream is just embarrassing, but it's a sign that your prostate is physically obstructing your urinary system. And if left untreated, that obstruction can cause permanent damage. Warning sign then 4, post-void dribbling. You finish urinating, you zip up, you walk away, and then, there it is. A few drops, a damp spot. It's humiliating, You start wearing darker pants. You avoid certain situations. You feel like you can't trust your own body anymore. This happens because your prostate is blocking the urethra, and a small amount of urine gets trapped in the tube after you're done. When you move, it leaks out. It's not incontinence. It's not a lack of control. It's mechanical. Your prostate is in the way. And here's the emotional toll. You stop feeling confident. You start avoiding intimacy. You feel older than you are. You wonder if this is just your life now. It doesn't have to be. Warning sign in 5. Intermittent or stop and go flow. You start urinating. Then you stop. Then it starts again. Then it stops again. It feels like your body can't make up its mind. This is called intermittent flow, and it's a clear sign that something is obstructing your urethra. When your prostate is enlarged, the pressure in your bladder has to build up to overcome the blockage. But once it does, the flow weakens again, and the process repeats. It's frustrating, it takes longer, and it makes you feel like something inside you is broken. You're not broken, but your prostate is changing, and your body is working overtime to compensate. Warning sign in 6. Hesitancy, difficulty, starting to urinate. You stand at the urinal, you wait, you push, you concentrate, and nothing happens for several seconds or longer. Then finally, it starts. This is called urinary hesitancy, and it's one of the most common symptoms of benign prostatic hyperplasia, or BPH. When your prostate presses on the urethra, it takes more effort for urine to start flowing. Your bladder has to generate enough pressure to force the urine past the obstruction. That delay is your body struggling against the blockage. Some men feel self-conscious in public restrooms. They avoid urinals. They wait for a private stall. They feel like everyone is noticing. But here's what matters. Hesitancy isn't just inconvenient. It's a signal that your bladder is working harder than it should. Over time, that extra effort can weaken the bladder muscle, leading to incomplete emptying, infections, and more serious complications. Warning sign in 7. Urgency and involuntary leaks. You feel it suddenly, that overwhelming need to urinate. Right now. You can't wait. You can't delay. And sometimes you don't make it in time. This is called urinary urgency. And when it's severe, it can lead to urge incontinence. Leaking urine before you reach the bathroom. It's terrifying. It's embarrassing. And it makes you feel like you've lost control of your own body. Here's why it happens. When your prostate obstructs the urethra, your bladder becomes irritated. It starts contracting involuntarily, sending urgent signals to your brain even when it's not full. You feel like you have to go immediately, and sometimes your bladder doesn't give you a choice. You start planning every outing around bathroom access. You avoid long drives. You stop going to places where you can't get to a restroom quickly. You feel trapped, and you don't talk about it, because who wants to admit they can't control their bladder? But you're not alone. Millions of men experience this, and most of them are suffering in silence, thinking there's nothing they can do. There is. Now, here's where most men get it wrong. They wait for symptoms to tell them what's happening. They wait until the problem is so bad they can't ignore it anymore. But here's the truth. Prostate cancer, in its early stages, is silent. It doesn't cause pain. It doesn't cause symptoms. It just grows quietly until it's advanced enough to spread. That's why symptoms alone aren't enough. That's why screening matters. And that's why so many men are diagnosed too late, because they assumed that if they felt fine, they were fine. They were. Let me transition into something critical now, because there's a difference between an enlarged prostate and prostate cancer. And understanding that difference could save your life. Let's clear something up right now. An enlarged prostate BPH is not cancer. It's not going to metastasize. It's not going to kill you. But it can make your life miserable. It can cause chronic urinary problems, bladder damage, kidney issues, and infections. And it can seriously impact your quality of life. Prostate cancer, on the other hand, is different. It can be slow growing and harmless for years, or it can be aggressive and life-threatening. The problem is, You can't tell the difference based on symptoms alone. That's why early detection is everything. Here's what you need to know. A PSA test, prostate-specific antigen, measures a protein in your blood that can be elevated when there's a problem with your prostate. It's not perfect. It can be elevated from BPH, prostatitis, even a recent ejaculation, but it's a starting point. A digital rectal exam, yes, the one everyone jokes about, allows your doctor to feel your prostate for irregularities, hardness, or nodules. It's quick, it's not painful, and it can detect things a PSA test might miss. If something looks suspicious, an MRI or a biopsy can give you a definitive answer. Here's the guideline. If you're 50 or older, you should be talking to your doctor about prostate screening. If you're 45 or older with a family history of prostate cancer, or if you're African American, a group at higher risk, you should start even earlier. I know it's uncomfortable. I know you'd rather not think about it, but early detection saves lives. Period. You can't fix what you don't face. Now let's talk about what you can actually do, because knowledge without action is just worry, and I don't want you sitting there worrying. I want you taking control. Here are the 7 habits that protect your prostate. These aren't gimmicks. These aren't supplements with miracle claims. These are evidence-based strategies that work. Habit 1. Move your body daily. Sitting is one of the worst things you can do for your prostate. When you sit for hours, blood flow to your pelvic region decreases, inflammation increases, pressure builds on your prostate. You don't need to run marathons. You just need to move. Walk for 20 to 30 minutes a day. Take the stairs. Stand up every hour. Stretch. Keep your circulation strong. Physical activity reduces inflammation, supports healthy hormone levels, and helps you maintain a healthy weight, all of which protect your prostate. Habit 2. Eat an anti-inflammatory diet. What you eat directly affects your prostate. A diet high in processed foods, red meat and refined sugars, increases inflammation, and chronic inflammation damages your cells, including those in your prostate. A Mediterranean-style diet, rich in vegetables, fruits, whole grains, fish, nuts, and olive oil, has been shown to reduce prostate cancer risk and improve urinary symptoms. Focus on tomatoes, rich in lycopene, a powerful antioxidant, cruciferous vegetables like broccoli and cauliflower, fatty fish like salmon and sardines, nuts, especially walnuts and almonds. Your prostate responds to what you feed it. Give it the nutrients it needs to stay healthy. Habit 3. Stay hydrated, but time it right. Dehydration concentrates your urine, which irritates your bladder and worsens urinary symptoms. But drinking too much before bed guarantees you'll be up all night. Here's the strategy. Drink plenty of water throughout the day, but taper off 2 to 3 hours before bedtime. Avoid caffeine and alcohol in the evening. Both are bladder irritants. Habit 4. Keep your fiber intake high. Constipation puts pressure on your prostate and bladder, worsening urinary symptoms. Chronic straining can also weaken your pelvic floor muscles. Eat fiber-rich foods daily. Vegetables, fruits, whole grains, legumes. Aim for at least 25 to 30 grams of fiber per day. Your gut health and your prostate health are connected. Habit 5. Limit alcohol, caffeine, and processed foods. Alcohol and caffeine are diuretics. They increase urine production and irritate your bladder. Processed foods are loaded with sodium, unhealthy fats, and additives that promote inflammation. You don't have to eliminate them completely, but moderation matters. 1 or 2 cups of coffee in the morning, fine. A glass of wine with dinner occasionally, no problem. But if you're drinking coffee all day and alcohol every night, your prostate is paying the price. Habit 6. Manage your weight and belly fat. Obesity, especially abdominal obesity, increases your risk of BPH, prostate cancer, and more severe urinary symptoms. Belly fat produces inflammatory hormones that affect your prostate. Losing even 5 to 10% of your body weight can significantly improve urinary symptoms and reduce your risk of serious prostate disease. Habit 7. Know your medications. Some medications make urinary symptoms worse. Decongestants, antihistamines, certain antidepressants, and some blood pressure medications can tighten the muscles around your bladder, neck, and urethra, making it harder to urinate. If you're taking medications and your symptoms are getting worse, talk to your doctor.
There may be alternatives that won't affect your prostate. Let me tell you about 2 patients. The first man came to see me when he was 62. He'd been having symptoms for over 3 years, waking up 4 times a night, weak stream, constant urgency. He was exhausted. His marriage was suffering. He was irritable, depressed, and withdrawn. He told me he kept putting it off because he was too busy. The truth was, he was scared. He was afraid of what I might find. We did the tests. He had severe BPH, but no cancer. We started treatment, a combination of medication and lifestyle changes. Within 6 weeks, he was sleeping through the night. His energy came back, his mood improved. His wife told me it was like getting a husband back.